Hello dear aspirants, welcome to Ganesh Nursing Academy. So today I am going to discuss important MCQs on immunity. Okay. So I guess my classes on discussion of MCQs on various topics will be helpful for you. Okay, they are going to helpful for you. So all of you must please share this videos to your friends, as well as if you like the video, please press the like button and subscribe to the channel. Okay. So if you subscribe to the channel, it will boost me and it will help me to, it will motivate me to prepare more and more videos. Okay. So without wasting our important time, okay, let's discuss about important MCQs on immunity. Okay, let's discuss important MCQs on immunity. Okay, so what is this immunity? Okay, what do you mean by immunity? So immunity is nothing but it is the ability of host cell to fight against the microbial agent or a microbial organisms. Okay, so whenever a microorganism enter into our body host cells will fight against the microorganisms, will fight against the agent, okay, that antigen. So that ability of our host cells to fight against the microbial agents, okay, or antigen, it is known as the immunity. Okay, so let's discuss important MCQs on the immunity. So first let us discuss about the question number 1. Question number 1, which of the following immunity do we have from our birth? Option A, innate immunity. Option B, acquired immunity. Option C, active immunity. And option D is passive immunity. Okay, see here this immunity. So immunity is the ability of host cell to fight against the microbial agents. So this ability, this capacity is known as the immunity. So this immunity can be classified broadly into innate immunity and acquired immunity. Okay, so innate immunity means it is the immunity, okay, or a resistance that is developed, okay, that is present by birth. Okay, it is a immunity that is we have from the birth. Okay, so it is a immunity that we have from the birth. Okay, and what is acquired immunity? So this acquired immunity, it is a resistance or immunity, okay, so that is developed over a period of time, that is a during the lifetime, as we grow and grow, the immunity we keep on acquiring, so that is known as a acquired immunity. So this acquired immunity again classified into active immunity and passive immunity. Okay, so active immunity means our body host cells actively involved in preparation of immunoglobulins against the microbial agents. So this is known as active immunity. So active immunity is nothing but our body host cell. Our body host cell is actively involved in preparation of immunoglobulins against the microbial agents, against the microorganisms, that is known as active immunity. Okay, passive immunity means here our body host cell does not involve actively. Okay, here our body does not prepare any immunoglobulins against the microbial agents, but passively the immunoglobulins is transferred to our body. So this is known as a passive immunity. Okay, again in active immunity we can classify it into natural and artificial. Okay, in active, natural and artificial. So natural means naturally our body will start preparing the immunoglobulins against the microbial agents. So whenever a microorganism enter into our body, so our body will respond to that one and starts preparing the antibodies or immunoglobulins against that microbial agents. Okay, so then it starts preparing the immunoglobulins or antibodies and to fight against the infection, to fight against the infectious microorganisms. So this is known as natural active immunity. So what is artificial active immunity? So artificial active immunity means artificially, like artificially prepared vaccines. So when we administer it into our body, so what we do, vaccine means it is an antigen only where a disease causing factor is removed. So that once it is injected into our body host cell consider it as a it is our body host cell consider it as a antigen or microbial agents, and it starts preparing antibodies or immunoglobulins against that vaccines, against that antigens. Okay, so this is also happens actively. So that is why it is known as artificial active immunity. Okay, now what is passive immunity? Okay, so passive immunity means I have already told the body does not involve in active preparation of immunoglobulins. So immunoglobulins are naturally naturally it will transmit to the body. So that is known as a passive immunity. So what is the natural passive immunity? Natural passive immunity. Natural passive immunity means when immunoglobulins which transfer from mother to fetus, okay, through the blood, or the immunoglobulins which transfer from mother to baby by the milk, that is colostrum milk. So these are the example for a natural passive immunity. Okay, so here our body does not prepare any active immunoglobulins, but there is a passive transmission of immunoglobulins from mother to fetus through the blood, or transmission of transfer of immunoglobulins or antibodies from mother to baby by the colostrum milk. So this is known as a natural passive immunity. Then next, artificial passive immunity. So what is artificial passive immunity? So in artificial passive immunity, what we do here? Okay, whatever the vaccines. So the vaccines that is injected to the animal. Okay, so vaccine is injected to the animal, and animal body starts preparing the immunoglobulins or antibodies. So that after preparation of adequate amount of immunoglobulins or antibodies from the animal body, all those immunoglobulins or antibodies are extracted, and immunoglobulins artificially prepared. Okay, so now these immunoglobulins whenever required, so that immunoglobulins is directly injected to the body of the person. Okay, so then there is no active preparation of body host cell. Immunoglobulins are not prepared by the body actively. Directly the immunoglobulins are injected into the body. Okay, so this is known as a artificial passive immunity. Okay, so this is the classification of immunity. And what is the option here? Option A. Okay, so the question is, which of the following immunity do we have from birth? Okay, from birth. Okay, so since birth, what immunity we have? Okay, so since birth we have a innate immunity. Okay, so innate immunity is immunity that is present by birth only. It is determined by the hereditary factors and genetic makeup. Okay, if the hereditary factor and genetic makeup are very good, so the immunity will be very strong, and it is a weak if the hereditary factor is weak. Okay, or immune like a genetic makeup is poor, then immunity will be poor. Okay, so by birth, okay, the immunity we have from birth is innate immunity. So this acquired immunity, it is a immunity that is acquired over during the lifetime. Okay, that is acquired immunity. And this active immunity and passive immunity are the part of this acquired immunity. So the option of right option for this one is a innate immunity. So innate immunity is a right option for this question. Okay, dear aspirants, let's see next question. Question number 2. Okay, the immunity that is developed after exposure to infectious microorganism is option A artificial active immunity, option B natural passive immunity, option C artificial passive immunity, option D natural active immunity. Okay, so here the person, okay, so he has exposed to an microorganisms. He has exposed to the microorganisms. Okay, so he has exposed to the microorganisms, means he has got infected with the microorganisms. So the microorganisms has entered into our body. So after the entry of microorganisms, what happens here? What kind of immunity he will develop after exposure to the microorganisms? This is the question. Okay. So option A is a artificial active immunity. See here artificial will not happen here. Okay. So he is developing the immunity naturally here. Okay. After exposure to the microorganisms, if you prepare the immunity, okay, if you prepare the antibody, if these host cells, okay, prepare the antibodies, okay, or immunoglobulins against that microorganisms, it is not comes under the artificial. Okay, so what is then artificial active immunity? Artificial active immunity means vaccines. Okay, the vaccines, either it may be live vaccines or killed vaccines, when administered into our body, then our immune system starts preparing the antibodies, okay, or the immunoglobulins against that vaccine. And vaccines are the one which are made by removing the disease causing factor from that. Okay, so that is artificially vaccines are prepared, and once it is injected into the body and our body starts preparing that one. Okay, and immunoglobulins or antibodies are prepared against that vaccines. Okay, once it is injected into our body, so this is known as artificial active immunity. Okay, so here there is no like a vaccination is mentioned in this question, so it is not a artificial active immunity. So artificial active immunity, main example for artificial active immunity is a vaccination, okay, or immunization. So natural passive immunity. So here natural passive immunity. Okay, so what is natural passive immunity? Natural passive immunity means immunoglobulins are not actively prepared in our body. Okay, immunoglobulins are not actively prepared from the host of our body cells. Okay, they are been transferred, okay, from mother to the fetus, okay, or they are been transferred, okay, artificially. So that is known as passive immunity. See here, the immunity that is developed after exposure to the microorganisms. So this is an active immunity. Okay, after exposure to the microorganisms, the body starts preparing the immunoglobulins against the microorganisms. So this is the active immunity. So here natural passive immunity means what? Naturally there is a transmission of immunoglobulins from mother to the fetus. Okay, either through the blood or through the colostrum, breast milk. So if there is a transmission of immunoglobulins from mother to the baby, so this is known as natural passive immunity. So this is also wrong option. Okay. And next one is artificial passive immunity. So artificial passive immunity means I have already discussed. Artificial passive immunity means what we do here. So we inject the vaccines into the animals, and animal body starts preparing the antibodies. Antibody will be prepared by the animal body, and all after preparation of sufficient amount of immunoglobulins from the animal body, all those antibodies or immunoglobulins are extracted and artificial immunoglobulins are prepared. So whenever any person get exposed to any microorganisms, so these ready-made immunoglobulins are injected into the body. So this is known as artificial passive immunity. Okay, so this is also wrong option here. So there is no artificial. Artificial is not at all related to this question. So hence it is a wrong. So next one is natural activity. So this is a right option here. Okay. So here after the exposure to the microorganisms, our body starts preparing the our body starts preparing immunoglobulins or antibody against the microorganisms naturally. Okay, it may take more time, but it starts preparing the immunoglobulins or antibodies against the microorganisms. So this process is known as natural active immunity. Okay, it happens naturally, and our body actively involves in preparation of immunoglobulins or antibodies. So that is why it is known as natural active immunity. So immunity that is developed after exposure to the infectious microorganisms, it is a natural active immunity. Okay, students, let's see next question. Question number 3. Immunity that is developed after administration of vaccine is. Okay. See here you have to think after reading these questions. They have mentioned that what is the immunity? Okay, we develop after administration of vaccine. Okay, so this vaccine is a keyword here. So whenever vaccine comes in the immunity like these questions, whatever said, you have to use your brain. So this is obviously an artificial immunity because vaccines are artificial prepared. They are not a natural immunity. So all these passive options you have to remove. Okay. So option are here. So the immunity that is developed after administration of vaccine is, okay. First one is artificial active immunity. Okay. So it is a artificial active immunity. Okay. How it is artificial active immunity? So vaccines are prepared, okay, by the microorganisms. So they will microorganisms are they are disease causing factors from the microorganisms are removed, and they are now known as vaccines. And vaccines, once they are injected into our body, so our body our body respond that vaccine as a microorganisms and starts actively preparing the immunoglobulins, okay, against that vaccines, okay, and there is a sufficient circulation of immunoglobulins against that microorganisms, okay, and once a person directly exposed to such microorganisms, already he have a sufficient immunoglobulins in his blood. So if really an infection, same organism infection happens to him, also already immunoglobulins are sufficiently developed in his blood, so they are sufficient to destroy the microorganisms, and hence the body is not allowed to develop any disease. So this is actually the fact that is lying in the vaccination. This is the reason for administration of vaccination. Okay. So here the immunity that is developed after administration of vaccine, okay, it is a artificial activity. So vaccines are artificially prepared. Once it is injected into our body actively starts preparing the immunoglobulins. Okay, so the immunity is developed. So this is artificial activity. Okay, so after administration of artificial vaccines, our body actively prepare the immunoglobulins, okay, or antibodies to fight. Okay, enough immunoglobulins are prepared in the body. So that is what is known as artificial activity. So next option is natural passive immunity. So already I have told you natural passive immunity means natural transmission of immunoglobulins from mother to the fetus or the baby. Natural, there is a transmission. Here the body is not actively involved in preparation of immunoglobulins or antibodies. Naturally through the blood or the colostrum, breast milk, there is a transmission of immunoglobulins from mother to the baby. It is known as a natural passive immunity. So what is artificial passive immunity? Artificial passive immunity means what? We will inject the immunoglobulins, we will inject the vaccines into the animal body. Animal body prepares antibodies, okay, or immunoglobulins against that vaccines, and those immunoglobulins are extracted and prepared natural artificial passive immunity. Okay, so the artificial immunoglobulins are available now. So whenever any person exposed to any microorganisms, and now ready-made antibodies or immunoglobulins are required. So in that condition, artificial immunity, artificial passive immunity is developed by administration of that ready-made available serum or immunoglobulins. So that is artificial passive immunity. And what is natural active immunity? So natural active immunity means whenever a person exposed to any microorganisms, okay, it may be tuberculosis microorganisms or HIV microorganisms. If he exposed to any of the microorganisms, his body, okay, our body starts preparing the immunoglobulins or antibody against that microorganisms actively, naturally. So that is known as natural active immunity. Okay. So the answer, immunity that is developed after administration of vaccine is it is a artificial active immunity. Okay, dear students, let's see next question. Question number 5. Which of the following cell mediate the cell mediated immunity? Means which of the following cell is responsible for the cell mediated immunity? Okay. So option A is B cells, option B is thrombocytes, option C erythrocytes, option D is T cells. Okay. So see here, B cells are responsible for the humoral immunity. Okay, B cells are responsible for the controlling humoral immunity. Okay, thrombocytes are known as the platelets. So platelets are responsible for the controlling the bleeding. Okay, they will aggregate each other whenever a bleeding happens and they will control the bleeding. Okay, and erythrocytes are nothing but they are helpful in the transportation of hemoglobin, transportation of oxygen. Okay, that is they carry the oxygen from alveoli to the tissues. Okay, and T cells. So T cells are the one which are responsible for cell mediated immunity. Okay, so the cells which are responsible for the cell mediated immunity is a T cells. So T. Okay, dear students, let's see next question. Question number 4. Okay, a nurse is exposed to hepatitis B virus by needle prick injury and she has not vaccinated against hepatitis B virus. A infection control nurse administered hepatitis B immunoglobulins or serum. Okay, the nurse gets which type of immunity? Okay, the nurse who got a needle prick injury gets which type of immunity, they have asked. Option A is artificial active immunity, option B natural passive immunity, option C is artificial passive immunity, and option D is natural active immunity. Okay, see here a nurse, okay, a nurse while working in the hospital, by mistake she gets exposed to the hepatitis B virus. She is exposed to the hepatitis B virus by needle prick injury. Means after withdrawing blood sample or after putting IV cannula, okay, a sharp needle is pricked into her fingers, okay, and then she exposed to the hepatitis B virus by needle prick injury. Okay, and unfortunately she has not been vaccinated. She has not been vaccinated against hepatitis B virus. Okay, hepatitis B virus. She has not been vaccinated. Okay, so now what happens here? Infection control nurse administer hepatitis B immunoglobulins. Okay, so here the infection control nurse do not plan to administer the hepatitis B vaccine. He plans to administer the hepatitis B immunoglobulins or serum. Okay, what is the reason for this one? We'll see. And nurse gets which type of immunity? Okay, see here, a nurse while working in the hospital, okay, if she exposed to the hepatitis B virus by needle prick injury and unfortunately she has not vaccinated. She has not vaccinated means she has no immunoglobulins in her blood. Okay, there is no immunoglobulins against the hepatitis B virus. Okay, so and she has been exposed to the hepatitis B virus by needle prick injury. Now, okay, if we administer the vaccines, our body take more time to prepare antibodies against the hepatitis B virus. So that is not useful now. Now we require a ready-made immunoglobulins. Ready-made immunoglobulins is required. So that is the reason why infection control nurse administer hepatitis B immunoglobulins. Okay. So the immunoglobulins which are already prepared in the animal body by injecting vaccine to the animal body, already ready-made immunoglobulins are extracted and it is available as a ready-made immunoglobulin. So that ready-made immunoglobulins are administered to the nurse who got a needle prick injury. So the nurse gets which type of immunity? Okay. So option is artificial activity. So here we are administering the ready-made immunoglobulins to the nurse who has got needle prick injury. So it is ready-made immunoglobulins, okay, after extraction from the animal body. So it is not a natural immunity. So obviously it is an artificial immunity. Okay, but artificial, do you think it is activity? So the nurse who has got needle prick injury, there she is receiving the immunoglobulins directly, passively. Her body is not preparing any immunoglobulins. So here it is a not activity. So though it is artificial immunity, it is not artificial activity. Okay, because her body is not preparing. Here she is getting the ready-made immunoglobulins, okay, directly into her body. And next, is it natural passive immunity? Here naturally, okay, it's not natural at all, because we are artificially prepared ready-made immunoglobulins are injecting into the body. So artificial natural passive immunity, it is a wrong option here. Okay, it is because natural passive immunity, like a transmission of immunoglobulins from mother to fetus, okay, by the blood or the through the breast milk. Okay, so that is a natural passive immunity. So here it is not at all passive immunity, it is a artificial. Okay, it is a passive immunity, but it is a not a natural immunity, it is a artificial immunity. Next one is artificial passive immunity. Okay, so this artificial passive immunity is the right option here. So artificially prepared immunoglobulins are injected to the nurse who has got exposed to the hepatitis B virus. Okay, so the infection control nurse will ready-made available immunoglobulins. Okay, artificially prepared immunoglobulins against the hepatitis B virus are ready-made available immunoglobulins are directly injected to the nurse who has got exposed to the hepatitis B virus. So it is a artificial passive immunity. Okay, what is the last option? Natural active immunity. So natural active immunity, okay, she has exposed to the virus. Now her body may prepare the immunity against antibodies against the hepatitis B virus. But that is not a question here. What the question they ask, nurse get which type of immunity after administration of this hepatitis B immunoglobulins or serum they have asked. So it is an artificial passive immunity. Okay, I hope all of you got this concept. Okay, dear aspirants, let's see next question. Question number 6. Humoral immunity is controlled by which of the following cells? Okay, now the question is humoral. Okay, so this humoral immunity, this is a keyword here. Humoral immunity is controlled by which of the following cells? Option A, B cells. Option B, thrombocytes. Option C, erythrocytes. Option D is T cells. Okay, so already we have seen that T cells are responsible for a cell-mediated immunity. T cells are responsible for the cell-mediated immunity. Erythrocytes are responsible for the transportation, okay, oxygen. Okay, they are the oxygen carriers. Erythrocytes are also known as RBC, and thrombocytes are responsible for the controlling of bleeding. Whenever any injury occurs, okay, so to stop the excessive blood loss, these thrombocytes or platelets, they aggregate each other and they will control the bleeding. Okay, and it is B cells. B cells are one who are responsible for the humoral immunity. Okay, so B cells are the one which control the humoral immunity. Okay, so humoral immunity is controlled by B cells. So option A is a correct answer here. Let's see next question. Question number 7. Dash protect us from microorganisms that enters into our body. Okay, so whenever a microorganisms or antigen enters into our body, okay, which of the following is responsible for protecting our body? Okay, protecting our body from microorganisms. Option A, hemoglobin. Option B, white blood cells. Option C, platelets. Option D, none of the above. Okay, none of the above. So option A, hemoglobin. Okay, so hemoglobin is a wrong option here. Okay, so hemoglobin is not responsible for the protecting our body from microorganisms. It is responsible for transportation of oxygen from alveoli to the tissues. Okay, so it is actively involved in transportation of oxygen. So this is the wrong option here. White blood cells. Okay, white blood cells are the main cells which are responsible for the protection of our body from microorganisms. Okay, so the cells which are responsible for protection of our body from microorganisms is the white blood cells. So white blood cells is the right option here. Okay, these are the cells which will regulate the cell-mediated immunity, humoral immunity, and prepare the immunoglobulins against the microbial agents, and various immunoglobulins are prepared by these cells. So these cells are the one which are responsible for protection of our body from microbial agents whenever they are enter into our body. Okay, then next is platelet. Platelet is again a wrong option here. Platelet are responsible for controlling the bleeding. Okay, so whenever injury happens to our body, so they are the one which will control the bleeding by aggregating each other. So platelet will aggregate each other and protect the blood loss. Okay, they are not responsible for protecting our body from microorganisms. Okay, and option D, none of the above is the wrong option here. So option B, white blood cells. Okay, WBC is the right answer here. See here, whenever we get any infections, okay, doctor will do complete blood picture or CBC, complete blood count. Why they will do complete blood count? Just to see whether the patient have any infection or not. Okay, so if doctor finds that WBC counts is rise, that indicates that the person is exposed to the infection and his body is preparing immunoglobulins against that microorganisms. So when the WBC count increases, it indicates that the body is preparing immunoglobulins or antibodies against the microbial agents. So that is the reason why WBC count will increases in the infection. Okay, so I hope the concept is clear for you. So option B, white blood cells is the right answer here.